Hi everyone, this is Dr. Barazi. Thank you for joining us in one of our segments about kidney care. You will find those videos on Facebook, Instagram, or on YouTube. Please subscribe to our channel. So I shared recently on my social media outlet, in our Facebook page, kind of a picture of a home log of a patient's blood pressure. She is 84, 83. I had the pleasure of taking care of her now for almost, I would say, 9 years. And that blog has been an essential part of her 2-month interval visits since 2013. So she has been doing this nonstop. And every time she brings it, along with her medication, along with the blood test that we usually obtain a couple of days before the visit. So this is, I would say, the cornerstone of any ideal visit for a patient who has a kidney function less than 45% while they are addressing the kidney care with their nephrologist. So I shared that log, and then later on, a couple of days later, I shared something similar to this, which is, this is the time. So I'm going to have here time. I'm going to have here kidney function, which is the creatinine, serum creatinine. And I talked about levels. So we're going to do 1, 2, 3, 4. Now we're talking about years here. I'm going to just try to simplify it here. Let's say 13, 14, 15, 16, 17, 18, 19, 20, 21. So when I met her first time, she has been somewhere, kidney function wise, she has been somewhere right here in 2013. And that number took its course this way. So one time here, one time here, one time here, one time here. And our team is going to provide you with this log in the so you could see it directly, and you could actually see it in our Facebook page. And the idea is, at first you look at those numbers and say, oh, this is scattered all over the way. I want you to convert this to someone, I'm going to use X's there, and has less numbers because he's not following up that frequently. So he has someone like that. And you could see the divergence here between this lady's kidney function and this other patient, which I see a lot. I almost see this pattern in many unfortunate patients who has the lack of the disciplines and the belief. It's in their hands to have their log of their kidney function throughout 8 years this way, versus having his blood test ended up this unfortunate way, which is around somewhere here. I will have the unfortunate discussion at length, talking to him about the goal of care and about possibly starting what we call renal replacement therapy in the shape of hemodialysis or peritoneal dialysis. So those visits, almost quarterly visits, sometimes 6 times a year visit, whatever it takes to make sure I have the word stability is the true word to describe this patient level of care about her kidneys, is the mainstay to keep this patient having a very stable kidney function throughout these years. But this would never happen if she doesn't do her diligent work at home, watching what she's eating, taking her medication the way they're prescribed, being very informed about every single medication, and at the same time bringing a log so she could have the feedback of an expert like me or her primary care doctor to tell her, Miss X, you're doing amazing in this. Keep going, and hopefully you will never worry about dialysis. So someone like her, I'm hoping she will reach 90 and we will never discuss the word dialysis for the next 6-7 years. Stay tuned. Thank you for joining us.